This is C-Fund's Experts on Call on C-Fund 1410 AM. And in specific, it's All in Your Head, starring Dr. Paul Swingle. It's funny, I was at a function last night, and I was a little bit late, and I walked in, and immediately there was somebody pushing alcohol on me. And it was relentless. It was almost as if I wasn't part of the party if I didn't have a drink in my hand. And our subject today, among others, is alcoholism and dependency. And I'd like to say good afternoon to Dr. Paul Swingle. Nice to see you again.
Good to see you.
We have a lot of things to cover. I mean, there's so many different areas to look at. But first of all, I should tell our listeners exactly who you are. Dr. Swingle is a professor of psychology, and he was a professor at the University of Ottawa from 72 to 97, a lecturer in psychiatry at Harvard Medical School from 91 to 98, chairman of the Faculty of Child Psychology at the University of Ottawa from 72 to 77, and truly one of the leaders in biofeedback and neurotherapy, which is the therapy that we're going to talk about. It's all in your head. In simple terms, Dr. Swingle, what is biofeedback neurotherapy?
Well, neurotherapy involves normalizing brain function. It's based on measuring the electrical activity coming from the brain, the electroencephalograph. Many of our listeners might have actually had an EEG if they've had a head injury. And what we're looking for are inefficiencies in the way the brain's processing information. So we're looking at dysfunction in brain activity. The way it's corrected is referred to as neurotherapy, and there are several different methods for correcting brain activity. Neurofeedback, which is biofeedback of brain activity, various stimulation procedures, and so forth. And the good news is once it's fixed, which is why it's such an effective treatment for alcoholism and the addictions.
Which branches out into so many different areas that we could talk about the different kinds of drugs and medications, prescription medication. Are people born with abnormalities in their brain activity, or is it something that's environmental? Does it happen to us over time, or is it a combination of both?
We have both. Trauma, for example, is obviously an environmental influence, and we can see trauma when we do our brain assessments. We have genetic vulnerabilities. For example, one form of alcoholism, there's a genetic vulnerability. Doesn't mean you're going to become alcoholic, but it means that you're vulnerable. Those are the kinds of things that we try to correct.
There are a wide array of types of alcoholism. You were telling them off the air that I didn't realize there were so many. What are some of the branches of alcoholism?
The most prominent type is what we call the social alcoholic. Here there's not really a brain vulnerability in a sense. These are the folks who feel uneasy in a party. They may have a predisposition to anxiety conditions, not necessarily alcoholism. And they find that if they have a few beers or pop a few pills before they go to the party, they feel more comfortable in that context. So essentially they're learning how to self-medicate, and they're dealing with their anxiety with alcohol. Another form is a marked deficiency in slow-frequency activity in the back of the brain. These are the folks you can't find peace in your own head. You can't find the switch to turn the brain off. Predisposition to poor stress tolerance, anxiety conditions, sleep quality problems. These are the folks who drink because it feels good. It makes them feel better. Unfortunately, that only lasts for a little while, and then they become dependent upon the alcohol, and then they start to do heavy-duty destruction to both their body, their family, their work environment, and so forth. So that's another form. I can go on and on and on. And when we get some callers, I'm sure we're going to have some folks who have the various varieties of alcohol difficulties. That's not only alcohol. We get a lot of folks who are addicted to prescription medication, which is an extremely serious problem in our culture.
We are with Dr. Paul Swingle. It's all in your head. Dr. Swingle has imparted some great free advice and therapy right here on the airwaves over the last few months that his show has been on the air. And we are talking about alcoholism today. In fact, you had somebody come in. I thought this was a very compelling story, somebody that you've helped through her alcoholism. Tell us the story of a 40-year-old woman who arrived at your office intoxicated.
Yes, actually, this is a case I have in my book, which hopefully will be out before I retire. In any event, I received a phone call from the mother of this young woman pleading with me to see her. And I think the reason the mother called me ahead of time is because she knew that she would be arriving drunk. She arrived and she was quite intoxicated, and as a rule of thumb, no therapist will accept anybody who's intoxicated. You're simply banging your head against the wall. However, given the pleadings of the mother, who pointed out to me that this woman was very close to death, according to her physicians, if she continued at her level of intoxication, she was simply going to die, period. So I did an emergency treatment on her, and she was able to come in the next day sober. Then we were able to do some neurotherapy with her, and I received a very touching Christmas card from the mother. She was able to sit at the Christmas dinner being happy and present and not intoxicated, and the mother thanked me very much.
Wow. And you have a lot of patients that are going through the treatment for alcoholism and other dependencies, I understand.
Oh, yes. We have quite a significant client population who have an addiction problem. As I said, it's not only alcoholism, prescription medications, street drugs, gambling, sex addictions, and so forth.
Interestingly as well, you know if somebody's lying to you about being intoxicated with neurotherapy and biofeedback.
Well, if you're putting brain poisons into the body, you're going to see it on the brain assessments. So when a person is being treated, we're monitoring brain activity. Quite often, one of the problems that all therapists will tell you is that addicts lie to you. They'll come in and say they're clean or haven't been drinking or whatever. And you can see in the brain map, things are not moving the way they should be. And we confront them with it, because the bottom line is if the addict or the alcoholic can be honest with us, we'll work through all of the relapses and falling off the wagon and all that sort of business until we get them stabilized.
We're talking with Dr. Paul Swingle, a leader in biofeedback and neurotherapy, registered psychologist, and the telephone number is 608-0444. That's 608-0444. We're going to talk a little bit more about alcoholism and also specifically what happens to you when you go through a session, some treatment in biofeedback and neurotherapy. There's no pain involved, and the best thing about it, Dr. Swingle, is that once it's fixed, unlike some forms of medication.
The conventional approach to treating some of these things is to substitute the substance. So, for example, if the person's a heroin addict, then we substitute methadone. If the person is an alcoholic, then we try things like Butrin is a common one that's used. Antidepressants, anti-anxiety sedatives. That's really not solving the problem. You're substituting one addiction for another, albeit a more socially acceptable one, perhaps, maybe not as destructive. In any event, the difference with neurotherapy is that we correct the anomaly in the brain that's associated with this disorder, and we do some behavioral work with the person so that once the brain is normalized, then we pay attention to stability, make sure it's stable, and then once it's fixed, it's fixed.
More with Dr. Paul Swingle to come as we continue with It's All in Your Head with Dr. Paul Swingle from Swingle & Associates. Clinical psychoneuro... See, when you treated me, I didn't learn how to say the long names. How do you say that? There's a whole alphabet there. Clinical psychoneuro...
Clinical psychophysiology.
Thank you. My apologies. Dr. Swingle is a leader in both biofeedback and neurotherapy. Our subject of the day is alcoholism and addiction to painkillers. Do you ever find yourself in a situation socially, especially now at this time of year where you're out and